How do I know if I have cataracts? Well, you have trouble seeing road signs, difficult to see in the TV, driving at night may be a problem, glare from oncoming headlights, difficult to read, arguments with your spouse about what color something is. Cataracts affect your color vision too. Okay, why do cataracts cause blurry vision? Well, here is a diagram. See, this is a clear lens. It's optically clear. You can't see it. Okay? But if you get cloudiness in the lens of the eye, what happens to light as it comes in? Well, through a clear lens, you get a nice focused point. Through a cloudy lens, light cannot be focused. It's diffracted. And so that is why you have blurry vision. Nice, fine, focused point. Here, it's just kind of all over the place. Now, it does focus, but it's not clear pinpoint focus, all right? And hence, this says before or after, this is regarding cataract surgery. But before, what they're trying to say is that the hues of colors are not as good, the fine line of things is not as nice, the greenery is kind of blurry, things are blurry. That's basically what they're trying to say with this picture here. How do we get cataracts? Cataracts are caused by UV radiation. Trauma to the eye can cause a cataract. The long use of steroid medicines causes cataracts, high-dose steroids. Diabetics can get cataracts somewhere around the order of 10 to 15 years younger than most people. There's a reason for that. I'm not going to bore you with the explanation, but it has to do with the blood sugar levels. The lens lives off of blood sugar. Okay? So, and if you've got too much of it, the lens can't process it properly, and so the lens hardens and gets denser faster than a natural lens in someone who's not a diabetic. Okay, how does a cataract form? Here's a little drawing. How cataract form? So this is the cataract. This is the lens of your eye. Okay? This is the cataract sitting in the capsule. Remember when I said that layer of cells that makes a basement membrane? That basement membrane is the capsule of your eye, of your lens, excuse me. And it is held on to the side of the eye by these tiny little fibers called zonules. And these zonules are tiny. I mean, we're talking smaller than the human hair, tiny. They're small enough that they're hard to see with the microscope. They're just tiny. They're lost whenever an eye gets processed for microscopic evaluation. They're gone. They're so small they just don't exist anymore. The capsule that holds your lens in your eyeball is about 0.2 microns thick right here. It is tiny, thin, thin, thin. It's a little bit thicker on the anterior side, but on the back side, it's much thinner. Okay? That's what's holding your lens in place. That's why some people, they get smacked in the eye, the lens falls into the back of the eye. I mean, it's precariously held there. But strangely enough, it's tough enough that we can operate on this thing and all of that stay in place. It's pretty amazing. So, this is the lens of your eye. What happens? As you age, sunlight, UV exposure, diabetics, steroids, those type of things, keep progressing and your eye gets dark, the lens gets darker and darker. So we're right here, nice blue. I put blue so that it'll represent a clear lens. And so over time it just gets darker and thicker and denser so that light can't get through. So that's what a cataract looks like. That's kind of a blurry picture, but you got this haze to the lens. This is a nice cataract here. This one's been in the eye a while. Nice white cataract. It's real cloudy. Okay? Everybody recognizes that that's not normal, right? You're supposed to look into someone's eye and see that black hole there. Okay, so there's something wrong. That's a cataract. That's a cataract. This is a posterior cataract. That's in the back of the lens of the eye. Those can be very visually significant. For whatever, because of the physics of light, this particular type cataract can cause really blurry vision. People can have a nice kind of clear lens, basically, that have that spot in the back of the lens, and man, they can't see good. It's real blurry. Okay. So can you prevent cataracts? Well, yes, you cannot live long enough, and then you won't get cataracts. But some other things you can do, wearing sunglasses that protect you from UV exposure, taking a multivitamin every day. These are all things that you can do to try to prevent them from progressing, quickly. But in some cases, you're just going to develop it. It's just the way life is. All that stuff. But anyway, so cataract surgery. Here we have a nice cataract. This is your iris. We've dilated your iris really well so that we can get to the lens of your eye. Everybody remember the pictures that we looked at just a minute ago, where the natural lens of your eye is. It's sitting right behind the pupil, okay? So how do we get to it? Well, we got to go into the eye to get to it, right? Okay, so we go into the eye, and we peel off the capsule. See that? We make an opening in that little saran wrap, that thin, clear capsule. Like this. Okay? Pupil, cataract. We're tearing a hole in the capsule. Because if you remember, this portion here is holding the lens in place, right? Well, this is where we're going to put the man-made lens when we're all said and done. So this has all got to stay intact. So we just tear a little hole right here. Okay? Then we squirt water in around that little capsule. We actually fill up the capsule with water and loosen the lens of the eye. Okay? Inside the capsule. Then we go in and we start breaking up the lens of the eye with a special instrument called the phacoemulsifier. It's called phacoemulsification. Okay? It's called phaco because that is the Latin word. Latin? Greek. Can't remember that. Anyway, that's the word for lens. Okay? Phaco. So, that's not important. This little ultrasound tip vibrates about 30,000 times a second. I mean, it's sonic vibration, all right? It's vibrating really quickly, faster than the human eye can see. And it's emulsifying the lens. It's basically turning it into powder. And we just segmentally turn the lens into powder and vacuum it out, leaving this capsule in place. There's the ultrasound waves going right there. These you can see with the naked eye. All right. This is, we break up the lens in pieces and then pull it out and basically emulsify it like you would a pie. This is how it's done. This is the tip. It's about, the tip that I use is 0.9 millimeters wide. It's tiny, okay? Everything we do is under a microscope. This is the emulsification taking place. And again, we've left the capsule in place. We've left an opening right here in the top of the capsule so that we can get to the lens of the eye. All right. Then there's a little bit of thin membrane that's left, and we vacuum that off and get that all out so that you're left with this clear capsule with a little hole in the center up at the front part of the eye. So there you go. We've gotten the lens out and all the cataract material out. We've left this little capsule in place. All right? Then we fill it up with a gel-like substance and we put the lens in. This is how we put the lens in today. It goes in with this little shooter and it's folded up. It's a little hydrogel lens. It's silicone, basically. And so the silicone lens is kind of folded up like a burrito. And we slide it into the eye. Can y'all see the little capsule here? See, we've left the capsule in place. The capsule's been left in place all the way around. See, it goes all the way around. All the way around. And that lens is going to be placed in there and unfold in position. Voila. Then we suck all the stuff out. And there you go.